I lurk on TikTok. I'm the worst. I like lurk. I have like a fake account, where I don't ever post. I don't ever anything. But I look at some of these younger counselors and what they're posting, and it's just wrong stuff. It's wrong. I mean, it's like wrong. And it's because they don't have experience. So
Wait, in which ways? In which ways?
In a lot of
wrong?
ways. Like so for example, like narcissism, let's say, right?
Yeah.
Everyone likes to talk about narcissism.
Yeah.
The problem is that there's what we call differential diagnosis in psychology, meaning that, and MDs have it too, right? Somebody comes to them who has a fever and, whatever, that could be a diagnosis for 50 things, right? You have to figure out what it is. You have to differentially diagnose and figure out. In psychology, it's the same. You have to differentially diagnose. So if someone can look like a narcissist, but they're not, because they're actually a drug addict, and you didn't ask about their alcohol use, and they have all these issues, or someone dismisses the alcohol use because they think alcoholism is only if you're drunk every day. They don't realize that you can have one martini every day and be an alcoholic. You can have one martini every day and not be an alcoholic. But again, so when you have a lot of experience, you get a feel. I can feel when I'm looking at like a personality disorder versus a mood disorder. I can sort of, and I'm not saying I can tell right away, but trust me, like I'm in a consulting group where we have a lot of very experienced therapists and we help each other. We meet every month and we talk about cases. We get, another good thing is to get supervision always, no matter how good you think you are, because that's what keeps you good. So I do this supervision group every month, and we've been meeting for years, and there's psychiatrists in there and social workers, and there's a really great mix of us, and we trust each other and we staff our cases. And it's in there sometimes I'm stuck on something and I can say, I don't know, this person kind of has this, but I sort of see this, but I see these 20-year-old, very beautiful, usually very attractive sort of therapists on. And I can tell, I'm like, oh my God, they are making these sweeping statements that are really hurtful, that really, and I, God bless them. You know what? If everyone has a place. So maybe if I listen to this person, and even though it's wrong, maybe at least I'll start to investigate this area, and then maybe I'll learn the truth, right? So I'm not bashing them. Like, I think everybody has a place in the world, for different kinds of people who are ready for different kinds of information. And it makes me sad that it's been distilled into a 30-second shot or a 5-minute or 2-minute shot. And that's why I'm not on social media much, because I don't have much to say in 30 seconds. As you can tell, I can't shut up.
Podcasts are great for this, right?
It's like these are complex issues. They're not so simple. My podcast episodes are, 45 minutes to an hour, because it takes a minute to really talk about something. You know what I mean? To really like delve in and say why and where and how you can tell the differences, right? And so I heard, oh my God, just the other day I heard someone talking about suggestions for what to do when you're stressed. Right? I'm sorry, when you're anxious. And they were giving suggestions for what to do when you're stressed, which don't work when you're anxiety and stress are two different things. And the things you use, the tools you use for them are different. So if you use, and this is why a lot of people with anxiety they go, what's wrong with me? I've been using all these tools and nothing works. It's because they're using tools for stress. Those tools don't work when you're anxious. Matter of fact, they can make anxiety worse. So, and if I've had a history of trauma, telling me to meditate is the very worst thing you can tell me to do. So do you know what I'm saying? But people are on there giving these tips, and because they're not grounded in anything, and frankly, they're misinformed. They haven't been in it long enough to know, how you tell the differences. They're saying things, and matter of fact, I ended up doing 2 episodes on the podcast not long ago on, what to do when you're anxious and what to do when you're stressed. Like I separated them out because I was so upset by the information I was hearing. And I thought, I got to set the record straight here, at least on my podcast. But anyway, it's stuff like that. I think you would not try to get a medical diagnosis in a 30-second shot.